Hello everyone, we are Group 207 and we're going to talk about our design process for a wearable device to detect COVID-19. On the agenda today we have the introduction, the project requirements and performance criteria, the design solution, the environmental, social and ethical factors, as well as a summary. Our team has embarked on a project to develop design for a wearable device that is able to detect COVID-19. The device will, in our beliefs, revolutionize detection of COVID-19 and other related viruses, reducing waste, reducing time, improving accuracy, and improving the human experience. At the peak of COVID-19, early virus detection was extremely important for understanding how a virus spread and how to protect the community. Unfortunately, current testing methods are hard to access, inaccurate, and not pleasant to undergo for the majority of the public. Imagine a future without a device that will be widely available, cost-effective, and adaptable to present future needs. There's an Albert Einstein quote that we thought about while making a design for this that goes as, strive not to be a success, but rather to be a value.
Project requirements and performance criteria. From consultation with our sponsor and brainstorming, the following project required were development. First, accurate detecting of COVID-19. This is to ensure that the solution developed will fulfill the purpose of means of detecting COVID-19. Second, easy operation. This is to ensure that the solution developed will be able to used by a large number of potential end users. Safe to use. This is to ensure that the solution will be not easy expected to damage with the normal users. The project must be updatable. This requires to ensure that the solution developed will relevant for the foreseeable future. The last thing, the device must be comfortable. This requirement is to ensure that the solution will be able to get the accurate result it needs, as well as being able to continuously monitor the symptoms.
Alright, so for our device we developed the following performance criteria. The first performance criteria is that the design is cost effective. So this is to ensure that the design provides on-time accurate detection of COVID-19 symptoms while reducing the costs of purchasing single-use tests or lab tests every single time the user is experiencing symptoms of COVID-19. This will also lessen the resources, infrastructure and efforts needed for current detection methods of COVID-19. The design will be a one-time purchase only, and it will continuously detect COVID-19 symptoms without extra expenses. This criterion will be measured by how it compares to existing methods of COVID-19 detection in terms of its cost.
The design effectively collects the user's physical data and accurately interprets whether these are COVID-19 symptoms. The device will then communicate to the user, medical professionals and relevant medical authorities its findings. Any errors will render the design unreliable and will risk the user of inaccurate information about their health. The accuracy of the design will be measured by how accurately it can tell if someone is displaying symptoms of COVID-19.
It is important to note that asymptomatic patients exist, and therefore, the design will detect no COVID-19 symptoms on these users, despite being positive if tested by current methods. This does not lower the accuracy criterion, as there will be no inaccurate results if there are no COVID-19 symptoms to detect.
The next performance criteria is that the design must have a long battery life. This is to ensure that the device will be able to operate all day and collect the necessary information it needs to be able to tell if the user is experiencing COVID-19 symptoms. This will be graded on how long the device will be able to last. As the device is a wearable medical device, it will need to be comfortable for the user to wear. For it to be able to fulfill its purpose of detecting COVID-19 symptoms, the user will need to be able to wear it for long hours without it interrupting or causing them discomfort. To test the comfortability of our devices, we used a diverse population of people to grade how comfortable each device was. Because COVID-19 is a virus that will affect people of any age and any skill level, the device must be accessible to many different people. To measure how accessible the device is, we will see how much training a user is required to have before using the device. Many current single-use COVID-19 tests create a lot of waste. If our device is to be a good replacement for these tests, it needs to be able to be sustainable and get rid of this amount of waste that is created. To judge the accessibility of this criteria, it will be measured by how long the device will last with its lifespan in years.
We used a system decomposition to brainstorm the potential forms our design could take. Using this decomposition, we came up with 6 possible designs. The 3 designs we thought were less favorable were a necklace, an over-the-ears device, and an ankle bracelet.
We looked at 3 potential design options for what the device could be. The first was a watch, the second was a ring, and the third was a mask. We then scored them all against our performance criteria, with the watch coming out on top at 85% success, the mask in second at 64.5%, and the ring in third at 37.5%.
The design solution. Our solution utilizes existing design feature of a watch. For example, these are interchangeable adjustable straps. A watch face to communicate to the user and buttons for the user to control the device. The design incorporates many sensors to aid and detect the detection of COVID-19. The data from these sensors will be processed on the watch and upload to our service where the data analyzed. Then we'll be able to improve the device ability to detect symptoms of COVID.
The uploading of the data will be done through an internet connection that the end user will be able to opt into. This is to ensure that there are no unexpected costs for the end user. This also ensures that the end user has no obligation to provide the data. Our solution will utilize secure servers. Our solution will incorporate universal standards to ensure that it works well with existing technology. An example of this is charging and updating using universal serial bus or USB.
The design will be water resistant to ensure that it can be used in a wide variety of activities. The design will be lightweight and slim to ensure that it is comfortable to wear for prolonged periods of time. Multiple sizes of the watch will be available to accommodate different ages and people. The buttons and screens of the watch will be easy for all ages to interact with and to understand and use. Our solution considers future needs and can be expandable for the future viruses through updates to the detection algorithm.
So now we're talking about our environmental, social, and ethical factors. So the environmental factors we considered were that because we were planning on creating a physical device that we're using the finite resources of the Earth, it is important that we have a sustainable approach to not only the manufacturing of the device, but also how the end of the life of the device is handled. There are also important environmental considerations towards the packaging and delivery strategy of the device. The packaging of the device will use all recycled material and will not use any plastic. We have a program for customers to send their devices back at the end of the life for reuse or recycling.
Because the device is intended to use by people and must necessarily collect user data, ensure that the data is not used anyway that exploitative, such as selling the data. We also must ensure that the employees' welfare, safety, the financial equity is maintained.
The ethical factors considered and that we have to deal with to meet the following criteria will be to adhere to the Modern Slavery Act of 2018. The published core values are compatible with our own, and the processes relating to their integrity, for example, anti-corruption. We must abide by ethical acts such as insurance that we do not oversell the device, that we do price it fairly, and that we will commit to giving back to the community by providing some devices at a lower cost to the less fortunate.
So in summary, our solution, which has been developed using the systems engineering process to a concept design phase, will revolutionize testing for COVID-19. Our solution is adaptable and cost-effective and will be used by the majority of the population in the near future once manufactured. Our solution has considered the environmental, social, and ethical factors relevant to it. Thank you for your time.